Now coming to the next question, what is the purpose of using an anterior jig in the complete denture? Now the anterior jig, it helps you to record the centric relation, right? Remember, anterior jig, it is also known as Lucia jig, that is basically a deprogrammer. So that is used to record the centric relation of the mandible. It is a small, typically acrylic appliance. So remember, it is a small acrylic appliance that is placed on the maxillary anterior teeth. Now let us discuss the purpose of anterior jig in the prosthodontics. The primary function is to record the centric relation. So that is important for ensuring the proper jaw alignment and occlusion in the complete denture. So it helps to guide the mandible into the correct position by providing a stable and repeatable point of contact. Apart from that, its role is it is used as a in deprogramming muscles. Other is the jig, it provides a consistent and stable position for jaw. So that is important for recording the centric relation. So it is placed on the maxillary anterior teeth. The patient closes the mouth until the lower teeth, anterior teeth, they touches the jig. So that will encourage the condyle. To move in the centric relation. So the centric relation is recorded, is made for setting up the dentures. So your answer here would be the Lucia jig. It is used to record the centric relation. Coming to the next question, which organ malignancy metastasize more commonly to the oral cavity? Well, metastasis in the oral cavity, it can originate from the various primary cancers, with most common being the lungs. So why does the metastasis occur in the oral region, and what are the factors that contribute it? So first of all, the process of metastasis in the oral cavity, that includes, the first step is the cell detachment, and there will be invasion. Now the cancer cell, they will detach from the primary tumor and invade the surrounding tissues. So that involves the breaking away from the cell adhesion molecules like E. cadherin and penetrating the extracellular matrix using enzyme like the enzymes are metalloproteinase. Now the detached The detached cancer cells, they will enter the bloodstream or lymph or lymphatic system. So the cancer cell exit the bloodstream or lymphatic system at a distinct site and adhere to the endothelial cells that are lining the blood vessels, and they migrate into the new tissue. So once in the new tissue, cancer cells must survive, proliferate, and form a new tumor. The oral cavity, we know it has a rich supply network of blood vessels and lymphatics that make it a primary site for metastasis traveling around the system to lodge and grow. So what are the primary cancers that common metastasize to oral cavity? The first is they migrate to the lungs, often metastasize to the oral cavity due to the extensive vascular connection between the lungs and the head and neck. So the more commonly metastasis is from oral cavity to the lungs. Coming to the next question, the muscle soreness experienced by a denture patient after wearing denture for a few hours, it is most likely due to the answer is a reduced interocclusal space. So when the interocclusal space it is reduced, it can cause overclosure of jaw that leads to continuous strain of the muscle of mastication, like the masseter muscle and temporalis. So these muscles, they can become fatigue, may show soreness and discomfort. So the reduced space forces the muscle to maintain the mandible is in an unnaturally elevated position that leads to muscle fatigue, soreness and discomfort. So errors in the occlusion such as heavy contact points from the opposing teeth can create pressure points on the residual ridge that can even lead to the soreness. So this shows the importance of maintaining the proper occlusal relationship. Deflective occlusal contact can cause the denture base to shift that may lead to soreness on the slopes of the residual ridge. So that may also exacerbate the muscle fatigue as the muscle they attempt to stabilize the denture. Now the thumb sucking of habit of a child, the face would be, the answer is long and convex. So remember what are the effects of the thumb sucking? So there you will see is the anterior open bite. So the upper and lower front teeth, they do not touch when the mouth is closed. Apart from that, you can see is the increase overjet, maxillary protrusion, mandibular retrusion. Other important feature that it leads to long face syndrome that would lead to convex profile. Now the convexity, it is due to the forward position of the upper jaw relative to the lower jaw. So the thumb sucking habits in children, it results in a long and convex facial profile due to the dental and skeleton changes it induces. So the answer would be long and convex. Coming to the next question, the antibody interaction with receptive site of antigen, it is known as, the answer is affinity. Now first of all, you should know is what is epitope. Epitope, we know it's an antigenic determinant. So it is the specific portion of antigen molecule that is recognized and bound by antibody. Whereas paratope, it is known as the antigen binding site. So it is the part of an antibody molecules that bind to epitope on the antigen. Now what do you mean by term affinity? So the affinity, it refers to the strength of the binding between a single paratope of antibody and single epitope on the antigen. So that will indicate the tightness of interaction between individual antibody molecule and its specific antigenic target. Whereas avidity, it is measurement of the overall strength. Of binding between antigen and antibody, taking in account the multiple binding sites and the multivalency. So the antibody interaction with the receptive site of antigen, it is known as affinity. That is your answer. The specificity, it refers to the ability to detect small quantities of antigen or antibody. It is measure of how effectively an assay can identify the presence of target substance even at the low concentration. Whereas specificity refers to ability of antibody to bind to particular antigen or a closely related group of antigens. So the antibody interaction with an receptive site of antigen, the answer would be affinity.